Hi, I'm Dr. Sridhar Kalyanasundaram. In this video, we will be giving an outline of the neonatal intensive care unit or NICU. Some units have special care baby units or SCOBOs as an additional adjunct, and transitional care units or step down units as well. Depends on the size of the unit where your baby is being treated. So, as the name suggests, the neonatal intensive care unit is meant to treat newborns who need intensive care. And typically, newborn age is defined as birth to 28 days of age. However, we do manage babies who are older because the premature babies who are born, like say 24 or 25 weeks, they stay in the NICU for 4 to 5 months of age, and sometimes those with chronic lung disease or surgical problems may stay even longer. So as long as their weight is below 5.5 kilos, we can manage them in the NICU. Of course, when they start crossing 4 kilos, we look at transferring them to the pediatric ward because they are bigger. The incubator is a closed confine and they are not comfortable anymore. A heavy newborn, like up to 5 kilos or so, very rare to get such sizes, but of course we can manage them in the newborn intensive care unit as well. So as a parent, it can be quite daunting if your baby is admitted to the neonatal intensive care unit, and the reason the baby needs admission to such a unit is because they have a problem that needs close monitoring, significant input, which may need breathing support, IV fluids, injection of antibiotics, regular tests which need to be done, feeding in a special way like giving by tube feeds, giving supplemental oxygen, and they may need procedures or surgeries where they need post-operative monitoring. So just being in the NICU doesn't mean the baby is critically unwell. Baby needs a form of support which cannot be given in the postnatal area. So we can say neonatal unit care rather than NICU care, and when the baby is more stable, they come down to a special care category if your unit has that facility. And babies who are only briefly monitored, for example, a baby who is grunting soon after delivery, may be in a transitional care unit for a few hours, again if the unit has a facility. So some rules are very important in the neonatal intensive care. So hand washing, because all the basic newborns are at high risk of infection, especially the premature babies. So hand hygiene is the key, and you will always find labels in the neonatal intensive care units on how to wash your hands, how to use the hand rub, and the parent information leaflets always contain information on removing your wristwatches and jewelry, rolling your sleeves up to the elbow, and washing thoroughly. The staff do that, and we expect the parents to do that as well every time. So wear clean clothes when you go to the NICU. Don't wear woolen wear or over jackets when you go in, and in case of females, in culturally appropriate ways. If you are wearing an abaya, you should wear a clean one which is regularly washed, and so on, because anything that we take to the baby can carry infection. And the same precautions apply when a mother is expressing breast milk at home. She has to follow all the precautions to clean the pump properly, store the milk in a proper way. So even the breast milk that is pumped, if it is not expressed properly or the equipment used is not cleaned properly, and if you don't store the milk quickly after expressing in appropriate temperature, we may get contamination, and that can lead to complications like infection. The hand hygiene is one measure, and visiting policy is other measure that parents need to understand. And during current crisis like the COVID crisis, visiting policies may need to be revised. We don't allow children under 12 or even 16 years to visit the NICU because children are at higher risk of carrying viral infections, and that can easily spread to the very small preterm babies with lung disease, and that can cause further complications in them. Because we don't want frequent visitors, we may limit the number of people who come in, and parents are the only visitors we encourage. Most of the units allow some visitors at exceptional circumstances, but it's the parents who need to be with the baby, so you understand that it is for your own baby's well-being, and you encourage your friends and relatives to stay away, and that you would update them as needed and as appropriate. Usually the NICU team also communicates only with the parents for confidentiality reasons. And if you wish to share information with others, or you want your parents or other elders in the family to be present, you have to discuss with the team and agree on what is appropriate. The intensive care unit obviously has special equipment which help to manage your baby, and we have different forms. We have the incubator, which is basically a temperature maintaining box, and it has a facility to increase the humidity inside as well, which will help the smallest babies to maintain their temperature without losing water vapor. The open warmer systems can help to keep the babies warm for a period of time, and once the baby is able to wean off the incubator, we keep them in a warmer with a little temperature on and off as needed. That may be the stage before they step down to a cot, and the procedures are easier done on an open care system. So you might see the pendant system in your NICU, where we have the suspensions from the walls on the roof, and they have the sockets, oxygen and gas ports for each bed as a pillar. So some units have room or cubicle systems, and some units follow the pendant system. So these socket points and gas points are needed because a sick baby may need multiple gas carrying devices connected. So for example, we can connect the neopuff, which is the breathing support device for manually giving breathing support to the baby. We may need to connect the blender for the neopuff. We need to connect the ventilator, and sometimes while switching the ventilator to other form of ventilation like CPAP, which is non-invasive, we may need to switch the machines after testing the second one to be ready. So we may need to connect everything at the same time. And multiple electric sockets are needed for a bed because we connect the ventilator, the incubator, sometimes the scanners which come in for helping us, the multiple infusion pumps. A sick baby may need as many as 5 to 6 infusions running at the same time. So we have the parenteral nutrition or the IV fluid, which gives a nourishment. We have the blood pressure medications which may be needed. The antibiotics are given as infusions, medicines like caffeine, and blood products may need to be administered, and painkillers may need to be administered. So these are different infusions which may be running at the same time. So it's a critical field, and everyone working there has to be on their toes all the time, from preventing infection point of view, from maintaining asepsis, watching others do it properly, cleaning the equipment properly. So the nurses in the neonatal intensive care unit are the pillars, and hats off to them for working so hard for making the survival of the sickest babies possible. So it's very important to acknowledge the hard work. Of course, some errors may happen. You may see that people in a hurry may not use the hand gel properly. You can point out in a gentle way, and that's what the team does to each other in the members as in the team as well. The other part in the intensive care unit is communication. So there is usually a chain of communication. The nurses give the information to the junior doctors who are on duty and to the consultants during the rounds. And whenever there is a significant problem, we have a coding system where emergency callouts may happen. Parents are updated mostly by the senior doctors and by the registrars on the night duty or evening shifts if needed, if there are changes. And most of the time, if there are significant procedures happening, they may need to take consent from the parents or families. I mean, each unit has different practices in terms of what procedure needs a consent, but in general terms, anything significant from the norm needs a consent. And it may be a verbal consent which we may document in the file, or it may be a written consent which may need your signature. The length of stay for babies in the neonatal intensive care varies a lot. There are babies like those with the low sugar, or those with the high level of jaundice, or those with just the initial fast breathing term baby after cesarean having wet lungs. These babies stay for a day or two, and sometimes for 3 to 4 days. These are the short stay babies. And then we have the extreme preterm babies, the surgical babies, who stay for a few weeks or months at a time. So again, the level of communication, the level of rapport we build up is very important in supporting you through the process. And as parents, the level of knowledge you need, the level of input you want to be involved in varies from parent to parent, and it's very important to convey that to the team If you need more information, please ask for it. And most of the teams are well versed with updating the full details to you as needed. And we also have a duty to keep you abreast of whatever important changes are happening in your baby's condition. It is usually a very stressful period, whether it is a short stay or a long stay, and the team understands what you are going through, and you need to be patient as the changes and fluctuations are not always predictable. Medicine is a scientific field, but we are dealing with human beings, small babies in this case, and obviously things can change very quickly. So very important to be patient with the team, understand the problems they are going through as well, and support them. And this applies to both sides. Empathy for what each person is doing is very important. So this is an overview of what happens in the NICU, what is involved, who the team members are, and of course salutes to the nurses who are the key members of the neonatal intensive care unit. I hope this video is helpful. If you have any questions, you can mention that in the comment section. Thank you.